Hello and welcome back. In Chapter 3, we're discussing methods of case management delivery. So, case managers is always focused on the clients and their needs and finding resources and linkage to those resources are the most fundamental parts of case management. To understand case management, we better explore service delivery and examine the goals, roles, strengths, and weaknesses of case management approaches. So, there's two ways to view case management: how services are delivered and who functions as a case manager. So seeing case management as a flexible helps meet clients' needs. Different approaches to case management focus on different goals, case manager responsibilities and roles and lengths of involvement with the client. Also differ by approaches of the service delivery. So each method of service delivery has a particular strength and a weakness. So it's really important to understand the different roles of the agency or the different roles of the case manager based off of the approach and based off of the environment that they're delivering their services. So knowing about multiple approaches helps to understand the service delivery system. So the form of service delivery depends on the agency organizing case management services. Services can be delivered through a one-stop comprehensive center, interdisciplinary teams, psychosocial rehabilitation centers, or crisis response. So case management services can be delivered at one-stop comprehensive centers, and they're characterized by the goal, which is for the case manager to meet all needs of the client at one point of access. Responsibilities, a broad set of including service coordination, intake interviewing, assessment, planning, monitoring, and case termination. In addition to leading a team of service providers, the primary role is to include advocate, broker, coordinator, planner, problem solver, and record keeper. The length of involvement varies according to the complexity of the client's case. The strengths, one location of service, multifaceted client assessments, holistic individualized plan, team-based service provision by common goals, regular communication, and shared report templates. Weaknesses are variations of resource availability, lower family engagement due to the strength of strong team and staff, and clients' possible over reliance on the center. So one-stop comprehensive services, the Wisconsin Works program provides services to parents and children. So the program represents a fundamental change in the way that services are designed and delivered. It is a comprehensive case management method. Successful treatment programs that focus on recovery. So work should not offer a continuum of services, but also integrate the services within a larger community. So comprehensive case management is in terms of an interdisciplinary team. So case management services delivered by an interdisciplinary team are characterized by the following. Teams can provide services for multiple problem clients and may include professionals from case management, mental health, social work, or occupational therapy disciplines. The team has determined which of the client's problems are the most urgent, and they prioritize those needs. So, comprehensive case management as a psychosocial rehabilitation. So, case management services delivered at psychosocial rehabilitation centers are characterized by the following: client's ability to function in a lower is lower as compared to functioning prior to the accident or traumatic event, and the goal is just rehabilitation. So, case management service delivered as a crisis response are characterized by the following: provisions of intermediate short-term help to persons experiencing a physical, emotional, or behavioral crisis. Case managers may initially focus on the source of the crisis and then provide services focused on long-term care. So, who assumes the responsibility of case management? So the needs of the client and the goals of case management determine on who assumes case management responsibilities. Other considerations include the severity of the problem, duration, existence of strengths of client support systems, skills of those involved in the case, and resources available for the client. So a person is assuming primary case management functions may be helpers, family members, peers, or the client themselves. So the primary role include brokering, coordinating a plan of service, problem solving, and record keeping. So the goal of case management may include short and long-term involvement with the case, coordination of services, helping volunteers, empowering clients. The responsibilities of the case manager may include finding and coordinating assessment service, obtaining access to specialists, identifying problems, and developing and implementing the case plan. So the case manager is a broker, coordinator, planner, problem solver, and record keeper. So the length of involvement can be short or long term. Strengths include flexibility, who assumes the case management responsibilities. Weaknesses include the non-professionals as case managers. Such persons may lack needed knowledge and skills, may not be able to monitor services, or may not be able to coordinate or access services. And non-professionals may not have the client's best interests at heart. So family as a case management. Due to rising costs and deinstitutionalization, more family members are being asked to act as case managers. So family members may need to help professionals when crisis occurs. So peers performing case management functions. So the rising costs are the increasing use of volunteers as case managers. Volunteers receive initial and ongoing training and supervision. The client as a case manager. Strength-based case management emphasizes delivering a client maximum potential. Having a client serve as his or her case manager recognizes the role of self-determination, builds skills and resources, and helps the client learn to provide long-term care for him or herself. So roles constitute the actual work that the case managers do as they provide services to clients. Advocate speaks on behalf of the client when they are unable to do so, or when they speak but no one listens. The case management represents the interest of the client, helps gain access to services or improve their quality. At the organizational level, the case management serves as a community organizer that influences policy and controls eligibility. At the legislative level, case managers can work to influence government policy and programs that serve the needs of clients. Brokers, role in which the case manager links clients to needed services. Broker helps the client choose the most appropriate service and negotiates the terms of service delivery. Coordinator, role in which the case manager works with other professionals and agency staff to ensure the services are integrated. The case manager can help the client with problems such as ineligibility, seemingly closed doors, poor service quality, or irrelevant services. The role of a consultant from the case management's perspective. These are outside professionals with expertise to identify problems, study it, and make recommendations. Cost containment. Talking about agency representatives who follow guidelines for allocating resources and advocates for the client's needs. The counselor. So a therapist maintains a primary relationship with the client, his or her family regarding mental health concerns. And the role of a planner compares from the service or treatment that the client is to receive. The planner evaluates to determine the client's functioning and to access service provisions. Problem solver. The goal of this role is to help make clients self-sufficient by helping them determine their strengths, find alternatives to their current situations, and learn to solve their own problems. The case manager is continually involved in problem solving. Many problems arise unexpectedly, and times must be allotted for them each day. Record keeper. So these are maintain detailed information relating to all contracts and services. Good documentation is always needed as for record keeper, because remember, if you didn't document it, it didn't happen. So it's really important that documentation constitutes the elements of the case management process and everything that was done for the client to help the client obtain those resources. So performance of multiple roles. Case managers perform multiple roles such as advocate, broker, coordinator, planner, and problem solver, right? Case managers can be the jack of all trades. So they're going to do a whole lot of different roles, play different roles with the clients and whatnot, because they're the client's biggest advocate. And again, they're trying to work to make sure those clients have linked the resources to help them move throughout their treatment and to make sure that when they finish their treatment, they have resources to sustain whatever treatment outcome that they've met. So organizational abilities. Case managers need organizational abilities. The ability to manage and organize multiple items and responsibilities. The concept of time is very important for case managers because again they have to be organized, they have to budget, schedule, respond to the clients, balancing out, slowing down, and actually being flexible for clients, right? And also have complete documentation to actually document the services that they've delivered. So again, we just keep talking about paperwork and documentation because it becomes so important in case management. So completing paperwork and documentation is another organizational skill that case managers practice daily. Documentation may include initial assessments, family history, psychosocial assessments, contact notes, goals, services plans, and evaluations. Communication skills is also very important. You have to be able to listen, question, and persuade the client, and actually establish a relationship and identify problems through assessment. And most of those assessments are going to be verbal communications with the client. Setting specific knowledge. So case manager needs setting specific knowledge such as typing, computer knowledge, understanding of human behavior, knowledge of systems that impact clients, and street smarts. You have to have ethical decision making. So case managers must engage in ethical decision making, the process of identifying ethical issues and asking questions and making appropriate professional responses. Boundaries. Case manager needs boundaries or rules and limits between themselves and their client to keep themselves safe and the client safe. And finally, case managers need critical thinking. They must think critically and clearly, asking the right questions, not taking things at face value, and continually evaluating. Personal qualities for case managers: being flexible, patient, self-confident, and sense of adventure. And multicultural perspective. Case managers need a multicultural perspective and must attend to the ethnic and cultural dimensions of each client because each client is going to be different and you can never put any client or group of clients in a box. So depending on what state you're in, case management can be different in terms of the duration, in terms of who provides the care or whatnot, and what trainings are available for case managers and what certifications are needed for case managers.